Hey guys, we are continuing our functional medicine case review of Jemma. If you're just now joining us, then I'm going to recommend that you start with the other videos first so you can get her case history so you know where we are in the case. So we are currently going to review her new labs and kind of compare them to the old labs. So let's start. All right, here's her glucose. If you remember, old labs show a consistently low normal, actually not even normal, but a consistently low hypoglycemic state. Her current fasting labs are high. Not high, but we said optimal for blood sugar is 85. Now, based upon this, I'm going to run an A1C on her, which is a measure of what the blood sugar has been doing over the last 90 days. So we have a person who, this is 32 points higher than her typical on fasting. This is not normal for her. So something is way off. Something's stirring the pot, so to speak. So if you remember in her case, she was doing pretty well, and her new complaint is lots of abdominal pain and discomfort after traveling to a Central American country about 4 weeks ago. So glucose is high. So we're concerning ourselves with, okay, what's stirring the pot here? Could there be, now this is important to know, when you have one autoimmune disease, you are at increased risk of developing other autoimmune diseases. So she has Hashimoto's, we know that. So she has thyroid autoimmunity. She also has a positive ANA. Could she be, what could this represent? Maybe she's sick, maybe she's got an illness right now, or could it represent kind of an expansion of her autoimmune issues into maybe a type 1 diabetes, which can occur in adults. It's called LADA. So could that be that? Let's stick a pin in this, and I think on follow-up labs, these labs just came in just a few days ago. On follow-up lab, I will run an A1C to see if this has been a trend over the last few months, or if this is just something right now. Okay, uric acid. Uric acid is 3.5. Uric acid is a marker of inflammation. It's also elevated in inflammasomal disorders. We see it in gout, which is the quintessential inflammasomal disorders. But interesting, I'm on the exam committee for the American Board of Clinical Nutrition. And every year somebody submits a question, not me. This is a good question, but when you see low uric acid levels, she's not low, so the reference range is 2.5 to 7.1. I would say she's in the spot on perfect range. But when you see low levels, oftentimes it's a molybdenum deficiency, and you want to make sure you supplement with that. I'm not even sure if molybdenum is in my multi. I have to look at that. So there you go. All right, her bun is in the healthy range. Her potassium levels, look at that, they're up. So last time we were looking at kind of some chronically low normal potassium levels, and we also saw in her a borderline high level of carbon dioxide, CO2. But look at it now. Her potassium levels currently are looking better, which could account for the CO2 levels coming down as well. Calcium is good, and we said before that elevated calcium levels can be a sign of cancer. So having been a cancer survivor, we want to keep our close eye on that and making sure that they're not getting any higher than the 10 mark. So that's good. All right, moving down, alk phos, again, it's always been in the 40s for her. We talked a bit about low levels can often be a sign of not enough zinc in the diet, and so we recommended she eat oysters or take zinc. LDH, this is high. This has historically been low in her. And we talked before about low levels underneath the 150 mark being a sign, or being, it puts you at increased risk for having kind of a reactive hypoglycemia where you see low blood sugar levels and some crashing, especially after you eat some sugar. So why is this high? That's interesting. So So with a cancer survivor, this could be a representation of some, malignancies. So we want to just stick a pin in this. It's just a generic. When we see this, there could be tissue destruction. It could be, it's non-specific. It could be a hemolytic anemia, so she's not anemic, so further on down we'll see that. But so it could be tissue destruction, could be elevated in a virus, could be elevated in malignant neoplasms. We see it also elevated in heart issues, cardiovascular disease, liver and gallbladder issues, biliary tract issues, and low B12. So something's not right on her. So something's starting to pot. So we see an elevated glucose over normal. We see her, the same alk phos, but we see an elevation of a historically normal LDH. So we definitely know something is going on here. Liver enzymes, again, are looking normal. Iron looks good. Her lipids, these are much, much, much higher. She normally is 170. This is much higher than normal. So we're going to stick a pin in this, and not sure why. But when we look at lipid levels, we want to take the total cholesterol and so this is high, and she's not a big person. So this would be on the high side as indicated. But one way to see if it's at least in balance is we take, we call it the rule of halves. So if the total cholesterol is 234, we half that. And half of that is what, 125? No, is that right? So about 120-ish or so. And so the triglycerides should be under that, which hers are 62, which normally goes along with kind of a healthy blood sugar level. So that elevated glucose level is definitely a mismatch. Something's up with that. It's not normal for her. So she is less than the 120 level, or the 115. Actually, it's 116. So she's less than the 116 level at 62. So that's good. And half of 116 would be 80, and she is above the 80 mark. So at least her cholesterol is in some kind of balance. But she does have some risk factors there with cholesterol being high as well as the LDL being high. Our next round, to really dig deeper, we're going to do a VAP test on her to see how much of this is genetics playing part in her cholesterol. So, because there's some better treatments, niacin and omega-3s and some other things, if there's more of a genetic component to her hyperlipidemia. Okay, here we go. Look at this. Look at that thyroid. Now, I didn't show you on the last lab report, but her thyroid, historically, she's very level. Typically, it runs 1.2 per TSH. Now, the way to interpret a thyroid, when you see a high TSH, it means the thyroid is lower. It's hypoactive. The TSH stands for thyroid stimulating hormone. It's a brain hormone that tells the thyroid gland to start producing more hormone. So think of this as the brain is yelling at the thyroid, saying, "Come on, get going! Start secreting start making more thyroid and producing that." So she definitely has something going on, because normally she has been very, very steady with her thyroid over the last 10 years. It fluctuates very little. She has a once-a-year checkup for her Hashimoto's from her endocrinologist, and ultrasounds have been normal. She's had some biopsies along the way, and her nodules have been pretty normal. So very steady thyroid. This is definitely a departure from normal. Could this be causing some of the elevated other lab findings? Could this be causing some of the elevated sugar? Maybe. But what is stirring the pot? This is not normal. Okay, moving on. Now, we're at the 10-minute mark. We're looking at the blood count. You can tell a lot from a blood count. So, white blood cell count, good. That's in the norms. Red blood cell count, hemoglobin and hematocrit, no anemias, very good. Her MCV, that's the size of the red blood cell. The volume of it, that's at 90. We like to see it 90 or below. It can oftentimes indicate not a B12 or folate in the diet. So that's all looking pretty good. Our platelet levels are pretty good there too. So now let's look here. neutrophils, lymphocytes, monocytes, eosinophils, and basophils. This is a window into what's going on with her immune system. So the mnemonic is never let my engine blow. So neutrophils, lymphocytes, monocytes, eosinophils, basophils. Healthy people, what we like to see is a 60, a 30, a 6, right here, under a 3. She's 33. We like to see that under 3. The reference range are not established here. And then we like to see 0 to 1, preferably less. Now, we're gonna comment about two things. So this should be 60, it's half that. Lymphocytes should be 30, that's on par. And then our eosinophils, 33% of her white blood cells are being represented by eosinophils. It should be under 3%. That is not normal. Now, when we look down here, we see our absolute count, sky high. Should be no more than 0.4, so it's, you know, above it's above 4 times normal. So right here, I think this is what's flaming her up. This would explain some things. So now, when we see this here, we're seeing a shift away from innate immunity. So normally it should be 60 and 30, right? So less natural killer cells and a shift towards adaptive immunity. Actually, not even adaptive immunity. Your lymphocyte compartment's not even that expanded. It's kind of where it needs to be, but the percentages are way off. Now, what an eosinophil count could mean, eosinophils are high in a couple of different, I am slouching. Eosinophils are high in a couple of different disorders. Diseases of atopy, so allergies, asthma, eczema, and hives. Remember on her case history, she has a history of hives. She also had that pneumonitis, that a reaction from the radiation therapy she had for her second round of cancer. So when we see high eosinophils, we can get them mildly high in diseases of atopy, like allergies, asthma, eczema. I had some asthma a while back when I was in Texas, and my eosinophil count was near 10, which is higher than it should be. But that now, the other reason we can get a high eosinophil count is when we have a parasite. So, could this case really be looking like, you know, we got a person with autoimmune disease, we have some history of maybe her being Th2 polarized. So when we see, we briefly mentioned that, we need to do a whole lecture series on what T cell polarization means, but when we see a high eosinophil count, the person tends to be T helper cell type 2 polarized, which is common in Hashimoto's. Now, could this represent a new parasite infection stirring the pot, causing a flare of her autoimmunity? Maybe. So this is very interesting. So I think this is really where the case is going to land. So we're going to send her for a stool culture and see if we see anything. As you remember, a lot of her symptoms, stomach pain and reflux and just irritable bowel types of issues, started after a trip to Central America. And the fatigue, well, this could be, she could have had an autoimmune flare because of the parasite. So when you get a parasite, your immune system is tipped less because it's trying to kill worms and helminths inside these hollow spaces. So you get hollow space dysfunction. So GI tract, sinus, bladder, lungs, to try to kill off extracellular type of organisms, of which a parasite is one. So I think this is probably where the case is going to lead, right here, because of the elevated eosinophil count. Again, that should be 3. So take a look at your labs and remember the mnemonic 60-30, 630, never let my engine blow. So we are at the 15-minute mark. I'm going to wrap things up in one final functional medicine video.